Hi, everyone. I am Shakira with the Love and Money podcast, and I'm here today to talk about the two new oral medications that are coming onto market. I had talked about this in the past, but in the past they were under FDA review, and now it's certain that they are coming to the market. What does this have to do with money? Well, if you don't have your health, there's really no purpose to having money because you'll be laying on your back somewhere, not knowing where you are. So, health is priority. Of course, with money, you would get better care as far as maybe better physicians, better treatments, better hospitalization, things like that. But still, health is priority. Without your health, you truly do not have wealth. So, I'm going to talk about the two medications that are coming to market for COVID 19. Number one being Monulpirivir, and number two being Paxlovid. Both of these are antivirals, and I'm just going to talk a little bit about them. The reason being is that I'm in the medical field. So from time to time, I'm going to switch off to what's going on in medicine and then switch back off to what you really want to hear about, how to increase your income. But like I said before, without your health, you don't have wealth. So, what does this have to do with love? Because this is a love and money podcast. Love yourself enough to take care of yourself. Start drinking water. Start drinking the foods that you know. Start eating the foods that you know you're supposed to be eating, like the fruits and the vegetables. Start exercising, even if it's only a little bit of exercise. A little bit of exercise is better than no exercise. And then when it comes to eating the right foods, that really comes down to your habits, how you were raised, what you ate as a child. And so it's about breaking those 30, 40, and 50-year-old habits. And so, one ideal for eating the foods that you know you're supposed to be eating is by tuning into those people who are strong in that area. One example is Tabitha Brown um, on YouTube, and you probably know her. She's known for eating healthy. She doesn't eat junk. So maybe tuning in to people who are stronger in that area. So okay, back to what I'm here to talk about is the two medicines coming to market, the oral medicines for COVID-19, Monulpirivir and Paxlovid. Paxlovid is a combination of two antivirals. Those two antivirals are it's nirmatrelvir and ritonavir. So Paxlovid contains two antivirals in one, and Monulpirivir is one antiviral. And so, based on the studies, Paxlovid is more effective. So, if you were to get a prescription and your choice was between Monulpirivir or Paxlovid, Paxlovid has been shown to be more effective. With Monulpirivir, the dosage is 4 capsules twice a day for 5 days. So it's a 5 day treatment. It's real fast. It's a 5 day treatment, and it incorporates itself into the RNA of the SARS-CoV-2 virus. So it is a oral antiviral. They have the oral antivirals where meaning you just take a pill, and then they also have IV medications. Usually in the hospital, when somebody has severe COVID, they put them on remdesivir, and those come in um, little vials like this. And what you do is you take out a portion out of the vial and you put it into an IV bag, and then they hang the IV bag and they put the IV into your arm. So that's when for people who are critically ill, they usually put them on the IV meds, remdesivir. There's also another medication, the monoclonal antibodies, and so that is IV. There are others also, but so Okay, back to the two oral meds that are coming out, Monulpirivir and Paxlovid. Like I said before, Monulpirivir is the 5-day treatment, very short, incorporates itself into the RNA of the SARS-CoV-2. It's an oral antiviral. If you're pregnant, then it's advised to stay away from Monulpirivir because it can cause birth defects. So if you're pregnant, it's advised to stay away from Monulpirivir because it is known that it can cause birth defects. So medications, they prevent hospitalization for unvaccinated people in 1 in 35. So the study says if 35 people took this medication, it would prevent 1 out of those 35 people from going to the hospital. That's with the oral antivirals. This is for unvaccinated patients. They studied ages 18 and over. And so as far as the monoclonal antibodies go, they suggest that you stick with monoclonal antibodies if you're under 18, if you're pregnant, and for post-exposure prophylaxis. Patients do not have to pay for these medications. And so this is what is going on. You may have seen it in the news in the past about these medications, but they are coming to market. They're both antivirals. The Monulpirivir, which is one antiviral, and then the Paxlovid, which contains 2 antivirals and which is known to be more effective. And so this is just some information for you to have. I know that some people are for medicine, some people are against medicine, but there are certain situations where you're not going to be against medication. Like an example would be, say you're in severe pain, severe back pain, for example. Then in that case, I'm sure you're going to be trying to find a way to alleviate your pain. But I know there are people who are for medicine, there are people who are against medicine, there are people who are for getting vaccinated, there are people who are against getting vaccinated. If you saw all the protests happening in Canada with the truck drivers, the whole truck driver union, they're in protest about even the idea of getting a vaccine mandate. And so they blocked the bridge that goes from Canada to Detroit. Oh, if you've seen that story. So these medications are for those type of people who refuse to get vaccinated, who end up coming down with COVID, who become very sick, and then end up taking this oral medication to prevent going to the hospital. If they end up being in the hospital, they end up being on these IV meds, remdesivir, for example, to save their lives. So this is just for information, educational purposes only. It's not to sway you in any way, because I know you're going to have your own opinion regardless of what to do and what not to do. Just come and let you know what is in the pipeline and what the drug manufacturers are doing around this whole pandemic. Also, if you're not aware, they are planning for more pandemics to come because these pandemics are actually being created. They're not coming from out of nowhere. So this is the Love and Money podcast with Shakira. If you like this podcast, please share it with one other person and have a great night.